Welcome back, my dear students. Today we are going to uncover irritable bowel syndromes, a common digestive disorder that may not be life-threatening but can seriously affect our daily life. IBS or irritable bowel syndrome happens when the normal communication between the brain and the gut gets disrupted, leading to abdominal pain, bloating, and irregular bowel habits like diarrhea, constipation, or both. In this class, we'll explore why IBS happens, the major risk factors, the pathophysiology behind it, and the best management tips to keep symptoms under control. Let's make the complex science of IBS simple and easy to remember. Mechanism of occurrence. Why IBS happens? IBS develops due to a complex interplay between the brain and intestinal microenvironment. Altered gut-brain axis, which is the central mechanism. Normally, brain-gut communicate via nerves and hormones. But in case of IBS, dysregulated communication, that is abnormal motility and pain perception occurs. Clinical part, visceral hypersensitivity, that's a pain from normal gut distension occurs. Abnormal GI motility, rapid contractions, IBS-D, that is diarrhea type. Slow or delayed contractions are called IBS-C, that is constipation type. Irregular contractions, IBS-M, that is mixed type. Visceral hypersensitivity, nerves in gut become oversensitive in case of IBS, and even in normal stretch, bloating, cramps, urgency occurs. This is the image showing the irritable bowel syndrome, the bowel and the abnormal contraction of the gut. Gut microbiota alteration are called as dysbiosis. Common post-infection or after antibiotics treatment, my gut microbiota can be altered, which is called as dysbiosis. It explains post-infectious IBS. Psychological factors, stress, anxiety, depression, worsen IBS. Stress hormones like CRH or cortisol alter motility and sensitivity. Immune activation and low-grade inflammation. When immune cells in gut mucosa increased, it disrupts absorption and motility. Food triggers. High FODMAP foods like beans, onions, dairy, wheat can trigger the IBS. Caffeine, alcohol, fatty acid, fatty meals also can influence the promote the process of IBS, the IBS formation. Irritable bowel syndrome. Risk factors. Genders. They are more common in women. Age. Young adults like 20 to 40 years are most prone to this disease. Psychological. Stress, anxiety, and depression can promote IBS. History of post-infective state can influence the IBS. Dietary triggers like FODMAPs, caffeine, alcohol, fat, etc. Family history and genetics. Life cycle, poor sleep, sedentary habits can promote IBS. Pathophysiology of IBS or irritable bowel syndrome. Altered gut-brain axis. Normally the gut and brain communicate through neural, hormonal and immune signals. In IBS this communication becomes abnormal. Result, it exaggerated pain perceptions, altered motility and emotional stress influence bowel function. Abnormal gastrointestinal motility, IBS-D or diarrhea predominant. Faster gut transit, it is frequent and it has loose stools. IBS-C, constipation predominant, slower gut transit which causes hard stool or straining. IBS-M, that is mixed type, alternating diarrhea and constipation. Visceral hypersensitivity, nerves in the gut wall become overly sensitive. Even normal stretching like gas or food triggers pain. This explains why IBS patients feel bloating and cramps more intensely. Dysbiosis, that is altered gut microbiota, imbalance of gut microbiota due to infections, antibiotics or diet leads to excessive fermentation, gas and low-grade inflammation. Some cases develop after gastroenteritis or post-infectious IBS. Mucosal immune changes, low-grade inflammation in the gut lining, Increased mast cells, cytokines and immune activation contributes to pain and altered motility within gut. Psychological stress and CNS factors, stress, anxiety, depression amplify gut symptoms. The brain modulates gut sensitivity and motility, so psychological factors worsen IBS. Dietary factors like FODMAPs and fermentables, certain carbohydrates such as fermentable oligo, monosaccharides and polyps are poorly absorbed. Final common outcome in IBS: abdominal pain and cramps, bloating and distension, altered bowel habits like diarrhea, constipation, or both. Management approach: general and lifestyle, patient education, chronic but not life threatening, stress reduction, yoga, meditation, counseling, etc., exercise, and adequate sleep. Diet: low FODMAP diet, proven effective, high fiber for IBS-C or IBS constipation, avoid caffeine, alcohol, fatty meals. Medical management: IBS-D, which is loperamide or rifamycin; IBS-C, psyllium, polyethylene glycol, lubiprostone, linaclotide; pain or bloating, antispasmodics like hyoscine, diclomine, peppermint oil. Psychological overlay: SSRIs or TCS in low dose, no non-pharmacological CBT, congenital behavioral therapy, mindfulness or relaxation training can uh, manage the disease. So I hope this class helped you understand irritable bowel syndrome, why it happens, the key risk factors and the multiple mechanisms like altered gut-brain axis, abnormal motility, visceral hypersensitivity and microbiota imbalance. We also discussed how stress, diet and low-grade inflammation worsen symptoms, and how life cycle changes, dietary modification, and poor medications can keep IBS under control. Remember, IBS is a chronic but manageable condition. With the right approach, patients can live healthy and fulfilling lives. Stay curious, stay consistent, and keep learning. If you found this lesson useful, don't forget to like, share, and subscribe. See you in the next class. Thank you.